Hello, everyone, and welcome to episode 30 of the Pet Behavior Chat. And we have a super special guest with us today, and that is the lovely Dr. Gaelle Joanny. She's going to introduce herself a little bit further in a second. However, I'll just give you a brief overview. So Dr. Joanny is a veterinarian. She holds a doctorate in veterinary medicine from the Lebanese University in Beirut. And I think she has a big passion for food and animal nutrition because she also has a bachelor's degree in nutrition and food science from the American University of Science and Technology in Beirut. But she's going to give us a little bit more insight about herself. But currently, she serves as the scientific director for the Nova Pharma Group, which is a distributor group here based in the Middle East who have a range of amazing products, a few of which we're going to speak about today that obviously especially relate to behavioral health, behavioral wellness. So welcome, Dr. Gaelle. So lovely to have you with us.
Thank you so much. Thank you for having me. It's really a pleasure to be with you on this interesting podcast. Thank you for the introduction. So it's true, I'm a vet. I am from Lebanon. After finishing my veterinary medicine degree, I moved to Italy, to Sardinia, where I earned a PhD also in parasitology. The food part of the veterinary medicine and the inspection was always interesting for me. So when I did my PhD, I did it on cystic echinococcus, which is found in liver and lungs of sheep and goats. So also it's related to meat consumption and it can be transmitted to dogs. Then I returned to Lebanon, where I was teaching at the American University of Science and Technology for 6 years. And during this time, I was always passionate about nutrition. So I decided to also enroll in the nutrition and food science program at the same university where I was teaching. So yeah, this was a bit of my journey in education. Then in 2022, I moved to Dubai. I joined the Nova Pharma Group. Currently, my role is to lead the company's educational initiatives. So we do internal trainings for our team across the GCC countries and North Africa, as long as external trainings for vets and also healthcare professionals. Plus, in my role, I deliver university lectures here in UAE. Specifically, the topic is clinical nutrition, so small animal clinical nutrition course. Yeah, that's it. And we really do seminars. We are always engaged with vets, and our aim is always to share knowledge.
Yeah. See, you could introduce yourself so much better than I can introduce you. So thank you so much for that introduction. And yeah, what a super interesting field you work in. It's very diverse, I feel, and yeah, very interesting. So the topic that we're going to talk about today is stress and disease. And now we could probably talk about this for days because there are so many different diseases that really factor where stress plays a big factor. But we're going to concentrate today on two specific areas. And I know that these are areas that we definitely have some nutritional support products as well from your side. Perhaps we should quickly mention that the diets that you're mostly, I guess, familiar with now or talking about now are the Hills nutritional diets. Is that correct?
Yeah, sure. Definitely.
Yeah. So, and they have some amazing initiatives, especially surrounding stress and disease. And as I mentioned, we're going to focus on two different areas. So the first is going to be gastrointestinal health. And then the second is going to be lower urinary tract health, specifically for cats, one of my most favorite topics. But I think if we can get started perhaps with gastrointestinal health. So what do you think so I know that the microbiome has been a big topic in the last few years. We've had a lot more research. Even now for my exam study, there's a whole area which is just on gastrointestinal disease, and the microbiome features heavily. Do you think you can maybe chat us through a little bit? What is the microbiome? How does it relate to stress and how does it relate to our pets?
Definitely. So when we talk about gastrointestinal biome, it means we are counting in all the microorganisms like bacteria, protozoa, viruses, fungi, so everything that lives in the GI tract of a certain host. And this biome is super important for our pets because it has several roles, such as digestion, nutrient absorption. It also boosts the immune function. For example, it acts as a defending barrier against pathogens. So it competes with harmful bacteria. It protects them. It digests some nutrients that are unable to be digested by the GI tract, such as fermentation of fibers to produce postbiotics, which consist of shorter chain fatty acids. And these are important energy sources for the cells of the GI tract. So yeah, this is generally the GI microbiome. So it's this population of bacteria that lives in the GI tract of the pet with a lot of benefits to our pets. Now, a balance in this GI biome is very essential for obtaining these health benefits. In contrast, once it's in this biosis or in unbalanced state, then this can lead to GI diseases in cats and in dogs.
Yeah. And I think you just mentioned a really important word there, probiotics. So I think we're all hearing a lot more about probiotics and also about prebiotics. What is the role of those and how can we get those into our pets?
Okay, so we have probiotics, we have prebiotics, and we have postbiotics actually. So when we say probiotic, it's the live beneficial bacteria that help to promote a healthy GI biome. Usually you find it in nutraceuticals. You can never find it in food because when we talk about live bacteria, and we know that the food is processed under certain temperatures, so it cannot survive. And once the bacteria is dead, then you will lose all the benefits. While prebiotics are non-digestible fibers that you find in food, and these fibers are, we can call them nutrients for the beneficial bacteria in the GI tract. So once these bacteria consume those fibers, this will help the population to increase as well as the bacteria to produce postbiotics. So the fermentation of these prebiotics allow the production of postbiotics, which are very important, which have very important functions in the body, such as antioxidants, anti-inflammatory, and as I mentioned earlier, the shorter chain fatty acids, which are important nutrient sources for our GI cells.
Amazing.
Now, why like when we discuss hills, we always think about this microbiome because hills are the pioneers in the microbiome technology. So they've done a lot of research and studies on this subject. And now we have a patent active biome plus technology, which is a certain blend of prebiotics that we incorporate in our GI diets in order to improve gastrointestinal health by definitely supporting the good bacteria that are living in the gut.
Okay. So would you agree then that feeding an appropriate nutrition, something that's science-based, something that has the research behind it, is probably the best way to get the things that we need to get from a prebiotic, probiotic, and then being able to form the postbiotic? Is that the best way to get that into our pets?
Definitely, in my opinion, I always rely on nutrition because I believe that nutrition or prevention with nutrition is better than treatment. Plus, nutrition itself and including these healthy ingredients and powerful ingredients in the diet can even substitute a treatment with medication, which have a side effect in general on our pet's health. So definitely, I am with nutrition. Plus, we know that this microbiome is something very delicate and can be easily disturbed. So if we are always trying to maintain this balance and reinforce it with prebiotics from the diet, then we are ensuring a healthy microbiome.
Yeah, amazing. And I remember speaking to one of my other guests actually on a previous podcast that we were saying, you feed your pets anyway, so you may as well feed them with something that gives them those health benefits. And I think it's much more difficult and much more expensive as well to try and supplement a diet that doesn't have that already incorporated, with additional supplements. So I think finding a diet that has all of those health benefits incorporated, I think is the way forward for so many different reasons. Economical
Yeah,
reasons,
exactly.
health benefits, and you're feeding your pet anyway. So, you may as well feed
Exactly.
them with the best thing.
Exactly. And by the way, same principle always I tell everyone that it applies on us as well. So when we are eating healthy, sometimes we don't need any other supplement or any other medication. Just by following a healthy diet, we really can get rid and we can treat many diseases and many like irritable bowel syndrome. Many things are mainly managed by diets alone.
Yeah, no, absolutely, makes total sense. So obviously this is a behavior podcast, and we wanted to talk a
Yeah.
little bit about stress. So when we kind of think about the microbiome, and I know the gut-brain axis, there's a lot of chat about that, how gut health impacts behavioral health and how behavioral health also impacts gut health. Where do you see the links there, and how does stress potentially negatively affect gastrointestinal health?
Perfect. So you were mentioning this interplay between the microbiome, the central nervous system, and the GI tract. And any disturbance in any of these interplay may cause changes in the microbiome. And as we mentioned earlier, if we have a change that will lead to a dysbiosis, then this will lead to bad health consequences on the GI tract. So stress is one of the things that can affect this axis. Other things like a GI motility disorder, IBD, antibiotic use, all this can affect the axis. Now, when it comes to stress, dogs that are exposed to chronic stress are in the fight or flight response. So, in this response, it's the release of norepinephrine, it's a hormone released by the brain, which will lead to a negative side effect on the GI tract. It can lead to local inflammation, to increased motility, permeability, and sensitivity. Plus, the norepinephrine was shown to promote the growth of pathogenic bacteria in the GI tract, which also increase the risk for infection. So this is why we see a lot of patients that are cases, let's say, of dogs that are on chronic stress, and then we see signs of GI signs such as diarrhea, vomiting, abdominal pain. And unfortunately, it's a viscous cycle. So once we have the signs themselves create more stress on the dog, and then the cycle continue to worsen.
Yeah. And it's actually interesting because I have a lot of clinical patients where I see exactly that. So I see a lot of chronic stress cases or dogs with anxiety disorders where obviously we have a prolonged period of stress where we see that. But also I've seen a number of acute stress cases where we get this stress, colitis. And I'm thinking in particular of some of my air travel cases. So I have a couple of patients where we know if there's any disruption to their routine, if they perhaps move house, and then we had to prepare them for air travel, we knew that we would likely get a problem in the form of stress colitis. So treating that preemptively was really important.
Exactly. So anticipating the problem when we are really, when we know that we are moving, we have a new member coming into our house, we have any change in the routine. So new animal, new item, if we are changing our even schedule, like if we had a certain job with more flexibility, we stay usually more at home, and then we have a new job which is less flexible and we have to work from the office, then this change also will affect the dog's stress cycle and anxiety. Kids that are returning to school after, for example, long summer vacation. So many things can really lead to anxiety, especially separation anxiety in dogs. So anticipating and starting a diet. So here we're not asking anyone to start medication if we don't have a stress yet, but anticipating with a healthy diet can really bypass these chronic colitis, stress colitis that can happen later on.
Yeah. No, absolutely. And I agree. Prevention is always better than cure, right? So if you can do something preemptively, I think that's going to always benefit the pet more than then being reactive to something.
Exactly.
Yeah, no, absolutely. So when we talk about the specific diets that Hills manufactures, then which do you think are going to be the most beneficial diets for pets that are perhaps prone to this sort of stress colitis, or that we know maybe have a predilection, or that maybe just don't have a particularly healthy gastrointestinal tract and we want to improve the health of the GI tract? Which are the diets that sort of come to your mind at top of your list?
So simply, we have a diet called ID stress. ID stress, it's one of the diets among our GI range of diets. So as the name mentioned, it's a diet that tackles stress. And, as we said earlier, nutritional modification, it's one of the approaches to manage stress. Now, with Hill's ID stress diet, you have the combination of the ID diet, which is the intestinal diet or the GI diet, plus the stress part of the diet. So usually our ID diets are diets that are highly digestible. So this is important to make it easy for the patient to digest and to absorb the nutrient without leaving a lot of poorly undigested residues in the GI tract. So it facilitate the work on the GI tract. Plus the ID stress and the ID low fat. So the ID stress is a low fat diet. So also the low fat part decrease the complexity of fat digestion, because we know that digestion of fat is really hectic on the GI tract. So having a low fat formula also aid in digestion. Moreover, our ID and all our GI range is mainly has this active Biome Plus technology. So this prebiotic fiber blend from Hills that restore the balance of the intestinal microflora, and it supports the growth of beneficial bacteria in the GI tract. So these are generally found in all our ID diets. Now, when it comes to ID stress, it means that we are adding the stress part, the stress molecules. So for the stress, we have the hydrolyzed casein. So hydrolyzed casein, it's a protein taken from skimmed cow milk. And usually it is hydrolyzed. We call it alpha-casozepine once hydrolyzed. This molecule acts by binding to GABA receptors in the brain. So it has a benzodiazepine-like effect, like the Valium. But of course, without the side effect of diazepam. So without sleepiness, the dog will remain active and alert. And this will result in decreased anxiety in dogs. So this is one molecule. Another molecule, if you recall earlier, we mentioned that once you have this balance in the axis, you have a negative effect on the GI tract, which will affect the motility and gastric emptying. So you will have a faster gastric emptying and a decrease in the GI motility. For this, we added to the diet ginger. Ginger has been shown to have a gastroprotective effect. Plus, it has a relaxant effect on the GI tract. So it can decrease intestinal transit and increase gastric emptying. So it will oppose the effect of this imbalance on the GI tract. So yeah, we have hydrolyzed casein and ginger as main ingredients to tackle stress in this diet.
That is so cool. So I did not know about the ginger. I thought I knew the stress diets pretty well, but I did not know about the ginger. I love that. That's so great. And I
Yeah,
love
natural.
yeah, exactly. And that's what I love. The same with alpha-casozepine. So alpha-casozepine, I'm very familiar with. There are obviously a lot of other products that do contain that, and I use them a lot. I know how well they can work. I loved your explanation of the neurobiochemical actions of it, because that's one of the reasons I do like it so much, because I can actually understand the neurobiochemistry behind it. I think there are so many products on the market that have ingredients where the neurobiochemical activity isn't clear. And it makes it very difficult for me to understand how they actually work in the brain. And that's one of the things I love about alpha-casozepine. Plus, we have evidence base. We have quite a few studies on that, which is great. But the ginger, that's great. I didn't know that. So I learned something today. That's amazing.
Yes, exactly. So with Hills, they always focus on natural ingredients. And we have things that are obvious and everyone knows, like we have the active biome technology mentioned, hydrolyzed casein, but it has really much more. So you see the antioxidants, you see the omega-3 with the anti-inflammatory effect, you see the ginger. So it's a full, really well-designed nutrition to cover all the aspects and all the disturbances that can happen in the different parts of the GI tracts.
Yeah, no, that makes total sense. And again, I think it just shows, that the Hills diets are so well thought out. They're so well put together. They're so well researched. And that's one of the reasons that, I think Hills has been so successful for so many years. And one of the reasons I know that the vets at my clinic, certainly we always reach for Hills, or we oftentimes reach for Hills when we have a specific problem to tackle. So that just, goes to show again why Hills is such a great diet, really.
When you have a diet and you have a company really backed up by science, so we are doctors, we are researcher, we don't believe anything said without proven papers. And when I started the work with Hills, and when I started reading the references they have, the studies they made, and the technologies that they have now, really they are, even sometimes they are surpassing what's being done in human medicine. So really it's backed by science. And now I think we should mention the study done on alpha-casozepine in dogs, which is based on this study. This molecule was included in our diets.
Yeah, so we have a couple of studies on alpha-casozepine. Dr. Claude Beata, who is actually a veterinary behaviorist, he has the studies, the two studies that I think are most famous for alpha-casozepine, looking at alpha-casozepine on its own and also in comparison to selegiline, which is a monoamine oxidase inhibitor. Exactly. And do you want to chat us through those studies, perhaps?
Yeah, definitely. What I like about the study is that it started after one study showing the efficacy of alpha-casozepine on anxiety in cats. So once they discovered this in cats, they tried to do another study and try to check the effect of alpha-casozepine on anxious disorders, but now in dogs. And as you mentioned, the trial was conducted against a control molecule, which is selegiline. For audience, it's easy for them to know that it's an antidepressant. Usually it is used for treating anxiety disorders and cognitive dysfunction in dogs. So in this study, when they compared both molecules, they showed that both products were efficient to decrease the evaluation of emotional disorders in dogs. So the scores were the same, and we don't have any difference between them. And due to the efficiency and also the safety of alpha-casozepine, they recommended managing anxiety disorders in dog with this molecule. And also in the study, it was shown that the dose of alpha-casozepine to have this desired effect should be 15 milligram per kilogram of body weight. So this dose per day is able to reduce anxiety in dogs.
Yeah.
But here I would like to mention just one more thing about our diet. So you see with ID stress, it's written for dogs up to 14 kg. So here, because usually we know that small breed dogs are more prone to stress compared to medium and large breed, but still large and medium breed can have stress colitis. So why it's until 14 kg? Because the concentration of Zilcan or alpha-casozepine in the diet is suitable for up to 14 kg. Therefore, any large or giant breed dog that eat ID stress might not receive all the benefit from the diet. So for these breeds, we recommend adding here the supplementation such as Zilkan. So just to keep this in mind for large breed dogs, that maybe the diet alone will not be enough because you will not reach the desired effect and the desired level of alpha-casozepine.
Yeah, no, absolutely. And I think we're very aware of that the diets are for cats and for small dogs. And then, yes, supplementation with Zilkene over and above that is definitely recommended. I think otherwise you would have to feed such a large volume of food in order to be able to get the concentration of the alpha-casozepine into the larger dogs that it becomes prohibitive to do that.
Exactly.
Interestingly, just talking about the doses of alpha-casozepine again. So 15 milligrams per kilogram is the recommended dose, I think, by Zilkene and also in the literature. However, there are a couple of papers that postulate a higher dose, up to 35 milligrams per kilogram. And actually, that's the dose range that I use in some of my more extreme cases where perhaps psychopharmaceutical medication isn't indicated appropriate, not desired by the client, whatever it might be. So it is possible to give higher doses of alpha-casozepine quite safely, and I do that quite regularly.
Exactly. It's a very safe molecule. So higher doses won't cause any harm. It's the opposite. But we know that 15 milligram per kilogram will really reach a desired benefit in the case of stress colitis. So in any advanced cases, supplementing with higher doses would not harm, definitely will not have any side effect.
Yeah. No, sounds good. So before we move on to our kitty cats, I actually want to just quickly touch on one thing, and that is the interplay between gastrointestinal disease and behavior medicine in general. So I've done a couple of episodes in the past on the importance of physical health contributions to behavior presentations. And that's actually one of the reasons that I decided to specialize in veterinary behavior medicine, because I think this is so often overlooked. And also I was so astounded. So during my residency cases, which are now well over 400, the amount of patients that have a physical health contribution to their behavior presentation. And if we don't address that, if we don't treat the physical health disorder, it's really difficult to bring about that behavior change that the client is looking for. And gastrointestinal health is definitely right up there. I think it's something that can be very subtle. And also it's not always easy to tease out, is it anxiety that's causing GI issues, or is it GI issues that's causing anxiety? So you have to kind of do a little bit of detective work, and see how you can best approach those cases. But I have a number of clinical cases that really where GI disease is a big one. And in fact, I have one case ongoing at the moment, a French bulldog, of course, it's a French bulldog, who really is struggling with his behavior. And he's actually not in the UAE, he's based in the UK. And we're just trying to get on top of his gastrointestinal disease. He has lots of things going on, but one of the behaviors that he's showing, and I have some really interesting videos on this, is excessive licking of surfaces. And we have a great paper that talks about excessive licking of surfaces, and that probably about, I think 60 or 70% of the patients in that paper actually had an underlying gastrointestinal disease. And once the gastrointestinal disease was taken care of, the excessive licking of surfaces completely resolved. So yeah, I think just really interesting and important to bear in mind just how much we need to be cross-thinking about the physical disease and behavioral presentations, and why it's so important that we as vets are involved in behavior cases, that they're not cases that are just referred to a trainer, that actually we need to dig a little bit deeper in some cases.
Definitely, I totally agree. For everything behavioral, of course, you're more experienced than me, but everything really need a multimodal approach. So we need to avoid the stress factor. We need to do behavior modification. We need to add nutritional modification. Sometimes we might administer drugs. So really, it's a multimodal approach. And without the behavior part and alleviating the stress because it's the core of the problem, then the successful rate won't be that much.
Yeah, no, totally agree. All right, let's move on to kitty cats. So this is actually one of my favorite topics in the whole world. I could talk for hours. And we're going to talk a little bit about cystitis in cats. So just for the listeners, cystitis is basically bladder disease. And unfortunately, it's a very, very common problem in cats. And it's actually, it can make up to 10% of physical diseases presented to veterinarians in pet cats. So we're not talking about wild living or feral cats. We're talking about cats that especially live in the home. And in younger cats, so cats under 10 years of age, 75% of those cats have what we call FIC, which is feline idiopathic cystitis, which is a disease that has been compared to interstitial cystitis in humans. And we know that that has a massive, so stress is a massive contributor to the disease. So why do you want to tell us a little bit from the nutritional point of view of FIC and how we can kind of help to combat that?
Definitely. So usually feline idiopathic cystitis, one of the lower urinary tract diseases, and definitely it's the most common one. So it's something that it's something where stress plays an important role in the pathogenesis. So we have two risk factors actually for feline idiopathic cystitis. Number one definitely is the stress, and number two is obesity or overweight cats. So moreover, it has been shown that reducing stress by providing environmental enrichment significantly decreased the signs of feline idiopathic cystitis. Why this happens? So when usually a cat is exposed to a stressful environment, definitely we have the sympathetic nervous system responsible for the fight or flight response that will start being active. It will be turned on. And this sympathetic nervous system innervates most organs, but also the bladder. So the signal will go down to the spinal cord and then from the spinal cord to the bladder. And it results in a bladder mucosa that becomes more permeable. It results in a bladder wall releasing inflammatory substances such as inflammatory cytokines, and then it leads to pain. So moreover, when the cat perceives this pain, it will create more stress to the cat. So it's going to be also a viscous cycle that it repeats itself. And since the problem is in two areas, so you have a problem in the brain and you have a problem in the bladder. So one of the key points that we need to remember is that the treatment strategy or the diet should be aimed to have an effect on both areas in order to succeed. So, and this is why, by the way, sometimes those that have therapies directed only to the bladder have a high failure rate. And this is why with Hills, we are super happy to have one diet that combines all the properties of the diet that help maintaining a healthy urinary bladder and also the stress property. So, so in this diet, what we have as things to relieve. So we have several diets, by the way, just for those that are not familiar with Hills. So with Hills, we have a CD diet, CD multi-care diet. It's the basic diet for urinary system health. We have the CD stress, and we have the CD urinary stress plus metabolic. So two among the diets of the CD tackle the stress part, CD stress and the CD stress plus metabolic, depending on whether being overweight or obese is a risk factor as well. So if we suspect this in the cat, then it's super interesting to put the cat on this trio of CD, stress, and metabolic. Now, the stress part of the diet includes two proteins, so two molecules. One is the milk protein hydrolysate that we already talked about. It's the protein found in cow's milk, and it binds to GABA receptor in the brain, and it is shown to decrease the anxious behavior in cats. The second molecule, the second stress molecule is L-tryptophan. It also works on the brain. It's a precursor of the serotonin, which is a mood balancing neurotransmitter. So usually serotonin is something that cannot cross the blood-brain barrier. So it's very important to have adequate amount of L-tryptophan in order for the brain to synthesize this serotonin. So L-tryptophan also has been shown to decrease anxiety in cats. So now we have two molecules dealing with the stress and anxiety. Moreover, this diet, as I said earlier, it has the properties of the CD diet, the CD multicare diet from Hills, which is a diet tailored for a healthy urinary system and bladder. So it definitely have glucosamine and chondroitin to restore the gag layer, because when we have feline idiopathic cystitis, it means we have an inflammation in the bladder, which will affect this inner layer called gag layer. And then by adding glucosamine chondroitin, we will be providing the building blocks for the gag layer to restore. Moreover, it has antioxidants and omega-3 in order to dampen the inflammation, because when you have inflammation, and we know, we are aware about the advantages of omega-3 in turning down the inflammation. So feline idiopathic cystitis is the inflammation of the bladder, and we need to find a way to decrease this inflammatory cycle. And last thing about the CD range from Hills is that it's a range that do not rely on adding salt to the diet in order to prevent stone formation, or in order to prompt cats to drink more water. Instead, we use what we call potassium citrate, which binds to calcium, making it unavailable to form calcium oxalate. So it's a diet also that prevents stones from forming. As you can see, it's a diet covering all the aspects of the urinary health, whether it comes from the feline idiopathic cystitis, and whether it comes from inflammation due to stones in the bladder. Anyways, we are in this diet, we are focusing on this inflammation, we are decreasing it, and we are restoring the bladder wall.
Yeah. That's a pretty powerful diet. It has a lot of things going on. Yeah.
Yes.
I think, yeah, FIC for me is such an interesting disease, because for me, it's an example of that absolute interplay between physical and emotional health that we were just talking about. And when we talk about FIC, I love the way that it's often referred to as a susceptible individual being presented with a provocative environment. So we have some cats that perhaps are susceptible because they're genetically predisposed or they're epigenetically predisposed. Oftentimes early life experiences can cause them to become susceptible to FIC. And if they were to live in a household that is super quiet, no other cats, very calm, they would do just fine. However, if that same individual is perhaps living in an environment that isn't as calm, where you perhaps have a multi-cat household or you have other stresses or triggers going on, then that can be the trigger for them to develop FIC. And it's such an interesting disease due to the neurohormonal elements of it, right? Everything that you just described, the kind of the sympathetic nervous system activation, the activation of the C fibers for the pain element, the fact that that can actually then increase the permeability of the bladder wall, and can even, in the worst case, lead to transitional cell carcinoma of the bladder. So it can actually cause bladder cancer. So it's really a disease that we need to take very seriously. And there are so many different elements in there that we need to consider. Where can we actually intervene? And I think this diet, has so many different areas that it can intervene.
But can I add one more thing? As you were mentioning that with feline idiopathic cystitis, the main struggle is that the episodes are recurrent. So you have an episode, and then if the cat is still in this stress, then later on you will have another episode. So what happens with other diets, we know that other diets in the market that tackle the urinary system are given for a short duration. So you cannot exceed 3 or 6 months, I think. Whereas putting a cat on the CD range from Hills or our CD range is a diet suitable for lifelong feeding. So by this, we are ensuring that the stress is always controlled in order to prevent these episodes from happening again. So this is a very important point that I would like to highlight, especially knowing that cats are anxious from anything, from any new people coming, any sound, any other animal, any new life change, moving houses, or even if you place, for example, the bowl of food next to the litter, this is stressful for them. The onset of rainy season is stressful for them. So we know that they are very exposed to stress. And as you said, some of them are genetically predisposed. So having something that can be fed for life and alleviating the stress factor is super interesting in the long-term management of feline idiopathic cystitis.
Yeah, no, I absolutely agree. That's definitely a big point to mention, especially because if we do have recurring episodes of FIC, the risk is that those cats will at some point become blocked. So they'll form urethral plugs, maybe together with stones or crystals. And then that's when we get blocked cats, and that is absolutely a life-threatening situation. So it's very much in our interest to manage these cats over their lifespan, as you said, to avoid really these emergency type situations where you have a blocked cat that, if left untreated, they can die within 72 hours. So it's really a life-saving diet. I'm going to call it a life-saving diet.
Exactly, especially that we know that urination problems are the number one reason why pet parents send the pets to the shelter.
Right.
So by just and they don't know why. They think they are doing maybe this on purpose, because I have a friend who was struggling with this improper urination and urination in different places, such as the sofa, the bed. So she was thinking that the cat is doing this on purpose. She wasn't aware that the cat is really stressed, and this is a sign of lower urinary tract disease in cats. So by managing the case and controlling the urination, we will be also saving pets from being sent to shelters.
Yeah, absolutely. No, you make a great point. So inappropriate urination or feline house soiling problems are the number one reason that cats are presented to veterinary behaviorists around the world. And you're absolutely correct in that it's a really big reason for cats being relinquished or even euthanized. It's a big topic. Feline house soiling is a big topic, but certainly stress, I think, plays a part in, I would say, probably all of the cases that I've had, whether that then displays as urine marking or as urine voiding for, social stressor reasons. And yeah, talking about cases, I absolutely have a number of FIC cases because I think it needs to be seen in the clinic by a veterinarian, especially if you're concerned that they're blocked. But sometimes for the ongoing stress management, that's where veterinary behaviorists can really come in and be useful, because we can look at the environment, we can look at the social relationships, we can potentially prescribe psychopharmaceutical medication if it's indicated, but we can absolutely come in and give practical solutions and approaches to how stress can be reduced in the environment. And I think that's obviously for many young cat cystitis cases is such an important piece.
Yeah, definitely, especially that at this stage, a urinary diet cannot intervene for very young, for kitten and very young cats, definitely, and always multimodal approach and alleviating and knowing the stress cause is a life changing for those cats, definitely.
Yeah. Definitely. So is there anything about either of the diets that we've missed out on? Is there anything else that you'd like to just highlight again?
Just one thing regarding the CD range, because we really have very good studies. I'd like to go through them briefly. So we have a clinical study that was conducted at the University of Minnesota and Michigan State in the US. And here we have a grade 1 evidence supporting the effectiveness of CD multicare diet for cats in the feline idiopathic cystitis. So it was clinically proven that the feline idiopathic cystitis is reduced by 89% just by following the CD range diet. Moreover, the diet works, as I said earlier, on different aspects of the feline lower urinary tract diseases. So it's also a diet that dissolves struvite stones in as little as 7 days, and also reduce the risk of recurrence of struvite, calcium oxalate stone. It was shown that the diet significantly improved emotional scores and quality of life of the cats, and those that have at the same time feline idiopathic cystitis and weight issues. The combination of CD, urinary stress plus metabolic is also proven to effectively lose weight just by following the diet. So alleviating the risk factor which can be behind the feline idiopathic cystitis.
Amazing. And we always love things that are backed by science. We always love things that we have the evidence for, that we can see that it worked. And I mean, those numbers are pretty impressive. 89%, that's great. So
exactly.
Yeah, a really good way to finish off this amazing conversation. Thank you so very much. I learned a lot.
So fast. Me too. But the time went so fast. How come we finished in 45 minutes? Really, I don't know.
I know.
We have much more to say, definitely, maybe later on, but
absolutely. Well, I know that in one of the future episodes, we've already spoken about the fact that we'd like to speak about cognitive dysfunction syndrome in one of the future episodes. So I think that's definitely something that we can think about going forward. But I would love to thank you for your time. It's been so interesting
to chat to you. This smooth conversation. I learned as well a lot from your experience, and it's an honor to be with you today in this podcast, really. Thank you so much.
Thank you. And thank you, everybody, for listening. And we're going to see you next week for episode 31. Bye for now.
Bye.